Hello, welcome to the Hormonify podcast. Today's a little bit different. I'm going to have to read some material. I didn't get much sleep last night. Unfortunately, my German Shepherd, who's almost 14 years old, was ill, and I had to stay up with her last night. In fact, she's here with us. So all your dog lovers out there, you can understand that I didn't sleep well, and as that relates to hormone replacement therapy, it's a very good example of when you do not sleep well, which is what happens with 95% of people deficient in hormones. Your whole life will change. You can't think as clearly, your mentation is slower, your energy is down. And so people ask me, I'm not sleeping and I have low energy. I say, well, we need to get you to sleep. Well, my doctor said not to take my hormones, and since then, I have not slept well. Well, to me, this is in a way nonsensical. So what I want to make and emphasize is that sleep deprivation is extremely important to fix whatever hormone therapy you are taking. If you're still not sleeping well, beware. So let's go to the topic today, which is a general topic. And the reason why I have notes is because I want to make sure I don't miss anything today. And what it is about is the method of delivery. The actual how do you take your hormones, which most practitioners, especially some big corporations who are getting involved in this business, don't understand because they didn't do the research. They have no knowledge beyond the fact that they just want to go ahead and, for example, give you a patch and a pill. Now, after 10 years of research and 30-something years of actually administering the program, I will tell you that what makes us different and what makes you better will be the method of administration of the hormone therapy. Is just as, or maybe even more important than the actual dosage and what the doctor gives you in terms of the method of delivery. That is not what we utilize. So I go through a series of observations and research results that I performed many years ago to determine what is the best method of delivery, what gives you the sustained level of hormone through the day and night, and how often to take the hormones, all comes into play at Hormonify, which makes us different and, in my opinion, obviously, the only place to go to for hormone replacement therapy. So when I started this hormone research in about 1996, the common method of delivery was creams. This was done through a professor. Her name was Christine Northrup, who went around the country claiming that the cream delivery system is the best. It was a one-time day dose in the morning. You'd apply the cream. However, no one was able to produce research to show blood levels of hormones and how long does it last, and I did. And I showed that the level of absorption of the cream hormones, but mainly at that point, progesterone, estrogen, and testosterone. Progesterone was extremely deficient, levels to 1 to 2. Estrogen level was very variable. Sometimes it was low normal, sometimes it was nothing there. And testosterone was usually very high. And of course, at that point, no one was using adrenal gland support as part of the hormone replacement therapy. And there was no nutritional basis for what she was doing. So what I got to the conclusion was that at the time, even though that was really the way to do it. And this came from research from Dr. Lee, who wrote a book, who actually I read a long time ago, that really stated that the creams is a method of delivery, and that was the only technological advantage at that time. So it was utilized in mass, and my observation at the time was that it didn't absorb on a regular basis because the various factors on the skin had to do with how much it absorbs, how thick you apply it, whether or not you touch something, you put a sleeve over it. Do you apply it in such a manner that the skin is either dirty or wet? And therefore, that variable also came into play. But best results that were gotten was inadequate progesterone therapy, which, as we all know now, is the main hormone of hormone replacement therapy for women. For men at the time, there was only, later actually, was the gel, the androgel. And I studied that. And I studied it in an intensive manner, and how long does it last, and why men are not getting better with the standard therapy at the time, which was androgel. And same result. Very variable results because it was a skin application, and levels were inadequate to treat most of the symptoms, and the adrenal gland was not addressed. So that deals with that. That's a no. All of you people on the creams. And this is true in our Facebook group that Hormonify runs. And believe it or not, you have direct access to me. I review every listing, every post. so that I give you some direction. We must have hundreds of people complaining on the cream that not only do they not feel better, they feel worse. So it's a lot of money spent. It doesn't matter how much you spend if you're getting nothing from it or very little from it, because the levels have to be adequate to provide you with the medical benefits of hormone replacement therapy, not just symptom relief. And a lot of my other YouTube has explained exactly the details on what you're missing if you don't get adequate levels of hormone replacement therapy. That deals with the creams. The second one, which is we utilize sometimes because it seems to be the second best method, is vaginal inserts of suppositories. The reason why we don't use that much of it, first of all, it's inconvenient. Second of all, it's a little messy because it comes out on the sheets usually, some of it. And the third thing is a one-time-a-day dose. As we all know now, hopefully, that you should know that the half-life of all the hormones is not 24 hours. It doesn't last that long. So if you have a hormone that's just taken once a day, I think you're inadequate most of the time, especially when you're having symptomatology. Many women just stop using it. It's been a very common thing that people go on. What we utilize, as you all know, is the troche form, which is the oral absorption of hormones that are placed in a highly technical gummy bear called the troche. And this method has been proven beyond the shadow of a doubt to be far superior in every way. Expense, utilization, compliance, the relief of symptoms, and the long-term benefits of being on hormone replacement therapy. Levels I've checked over the years, but also initially when I did my research project for 10 years, is perfect in terms of getting symptom relief and also not having side effects or complications. So far at Hormonify, we have had 0 complications because we make sure we give the levels that are adequate to provide the blood levels that are necessary without overdosing. So again, compliance is a problem with the suppository, but we do have some women, most of them, who go on it temporarily because they have some dental work and they can't put anything in their mouth, which obviously is a problem. We switch back because they said there's no question that the troche makes them feel better. Injection. 1970s, 1980s, especially in the black market, injectable testosterone was the thing also for women. It is an absolute no-no today. We sometimes rarely need to augment a woman with testosterone injection. I would say once or twice a year because they just do not absorb the testosterone adequately through the troche. That is rare. However, the injectable testosterone for women is contraindicated because of the peak and trough. It goes very, very high and then it starts coming down. And so many of my patients who've been on medications that are peak and trough, especially the pellet, but obviously injection as well, experience that peak and trough. Now for men, it's different. For men, once or twice a week injection seems to be tolerated very well, and we give them levels that are just in male levels, and they're fine with that because they're male. But if you give a woman male levels, again, this to me is malpractice. You do not treat symptomatology of hormone deficiency, which is mainly progesterone, estrogen, a little bit of testosterone, and adrenal gland insufficiency with high dose of testosterone, which we'll get to in a second when we talk about pellets. Injectables, if you're having injectables, your doctor is 50 years behind the times. 50. So you need to reevaluate, and also most of those patients who come to us who have been on injectables will say that they feel terrible. They don't feel better. And that's because peak and trough comes in, and that's not the way hormones are not only produced in your body, but also should not be administered. I would say the most common act of malpractice I have seen in my 40 plus years of practice. Pellet therapy is dangerous. It causes severe complications. Giving women male levels of hormones is malpractice. That is, unless they decide with the doctor to transition to men. It is absolutely contraindicated. So those that you are taking pellets, there are many reasons why you shouldn't, but the main reason is it is dangerous. There are certain women with most likely genetic implications that are super sensitive in terms of hair loss to the testosterone. They lose their hair and it's a permanent baldness. I've seen that multiple times. I've also seen women who are on high-dose testosterone, which is what the pellet is, exhibiting extreme bone changes. Yes, their muscles build up, but they start to androgenize. They start to develop a male-structured body, and that is irreversible. However, if you do go on pellet, I want you to look very closely at the paperwork that you sign, because in the fine print, you have basically taken away your ability to sue the practitioner and the company. That is what you've done. Now think about that. Would you ever enter into a contract in any other manner where they say, well, we're going to do X, Y, Z to you, but you can't sue us if things go bad? Be very careful, because this is a serious problem in this arena, in the healthcare industry, where the pellet, which by the way is extremely expensive, which is an actual cut and insert every 3 months. So I call it the death by 1,000 cuts, the Chinese torture. Because over 30 years, which we have patients on the trochees for 20, 30 years, over 30 years times 4 is 120 cuts in your buttocks. Short term, people say, oh, I'm only going to do it once or twice. Well, why? If you're not going to continue it for the rest of your life, because if you want to get such benefits, which is what they're proclaiming, which is absolutely false, you do not get those benefits. You do not reverse osteoporosis. You do not reverse sexual dysfunction. In fact, because of the high dose of testosterone in women, I have seen hundreds of women who lose their sexual function and even after they stop the pellet, cannot have an orgasm. Women are not meant to have male levels of hormones. Period. So when a patient comes to me, which we have over 1,000 patients who have been on the pellet, long-term management is a nightmare because they constantly have problems with sexual dysfunction. They have problems with hair issues. They have problems with mood disorders, sleep disorders once they get off the high dose of testosterone. So when you are on the pellet, my suggestion is after 2 months, check your testosterone level. And if it is above the female range, depending on the lab, beware. You are being duped for the benefit of the practitioner who makes a ton of money giving you that medication via a pellet. So it may be well-intentioned by some practitioners, I have to say. Some practitioners just don't know what I've just told you. They think it's a good thing. They get sold, they take a 3-hour course. They're told everything is great, and they're told various lies from the company. I don't know what goes on, because in reality, it is obvious to me after all my experience that these pellet therapy patients are a mess. And they go through the peak and trough, and it's my clinical experience, and when I confirm the levels of testosterone, most of them have levels in the male range, and almost all have levels above the normal female range. So I want you to know that's objective evidence. I didn't know in the beginning. All I know is I started testing these people. I've had patients 6 months out of the last pellet, who still have male levels of testosterone. What I cannot find, and maybe it exists out there if you guys can help me, is a study to show the actual week by week levels of testosterone over 3 months. I can't find it. They tell you it releases itself in a very standard fashion over 3 months, so that in 3 months, at the end of 3 months, your level is the same as it is when you start the therapy. That's what they're telling you, or that's what they're implying. So to me, this is a real problem in medicine today. And you know I've said this before. Doctors don't care. They don't care about how well you do. They care about how much money they extract from you before you get frustrated. So if you're on the pellet, and I have in our group, a Facebook group, that's the second most common problem. I'm on the pellet, but my doctor tells me to increase the dose of this even though I'm feeling lousy. It's a matter of understanding the biochemistry, the physiology, and if you do not understand that, you will go ahead and go down the road of the pellet therapy, which is a mess. So recently, partially because of Hormonify, they've added into their regimen progesterone. But how do they take progesterone? They take progesterone in a capsule form. Micronized progesterone, there's only 2 doses available, 100 and 200. You can make your own dose. But either one, if you take the progesterone by a capsule form at night, it does help you sleep. But by 2 o'clock the next afternoon, you don't have any progesterone in your body. That's why we do twice-a-day dosing, because progesterone is excreted. It is transformed Some of it is digested in the stomach. Some doesn't get absorbed. Some goes and then goes to the liver. It's transformed to inactive product. Some of them is active. It circulates the body. By the second time around, the liver clears it up, excretes it, and it's gone. So what I'm getting at is that, again, if you don't understand the biochemistry and the pathways that are instrumental in understanding how to give a prescription, then the doctor will continually raise the progesterone. We had a patient in the Facebook group. My doctor increased me to 400 milligrams of progesterone. You can go on the Facebook group and go and look at it. And she was giving a list of horrible side effects and complaints. I've never used, in my million patient months of experience, I've never used 400 milligrams of progesterone. That's crazy stuff. And of course she was feeling terrible. But her doctor, whoever gave her that prescription, must know nothing about hormone replacement therapy. Not a little. I have a joke. I ask these patients, who's your car mechanic? And they tell me. And I say, well, go to the car mechanic. Probably you'll get a better result, especially if he has a wife on hormones, than you will with these doctors. And it's not funny, because it's true. They know nothing. And I constantly have to sometimes doctors call me, which is a blessing. And I explain to them, I tell them where to go, I tell them about the research, I explain to them what they're doing, and they learn, especially family doctors in small towns around the country. And I have respect for that. They admit they don't know anything, but patients are coming to them with various complaints. They check the levels. They don't even know what to do with the levels. They don't even know what levels to check, to be honest with you. But they check the levels. They see it's a problem. They see the patient suffering. They probably went to a 1-hour course, somewhere to tell them that they should be on an estrogen patch and a progesterone pill. And they try that, and the patient feels worse. And so they put them on the pellet, and the patient feels even worse. And then sometimes they'll call me when the patient says, oh, I found this doctor who specializes in this arena. And we have a nice conversation. And they sometimes will administer the proper program, or sometimes they'll say, well, at least I understand why it's not working well, which is an advancement. So it has to be a grassroots. You have to go to your doctor and say, hey, doc, do you know what you're doing? How much experience do you have? And if you don't, I have this doctor, Dr. Eckert. Why don't you give him a call? I don't charge for that. I want them to learn. I'm here to help. I'm here as a grassroots operation trying to convert the ignorance of American doctors to a place where we are knowledgeable, we're able to take care of the patient in such a way that they feel better, not worse. Our credo, do no harm. It's amazing to me how many doctors are doing harm to patients, both men and women. I'll be honest. I have men coming to me that are so overdosed, they're crazed, their aggressive behavior, they can't sleep, they can't even get an erection. And the doctor says, oh, well, it's because you need more testosterone. You can't imagine the things that I've heard, even with men's therapy. Less is more in this arena. Your body will produce its own testosterone for men if you fix the adrenal gland, and we use supplementation that has been proven over thousands of years to augment a man's testosterone. That is the beauty about coming here. We don't give all men testosterone. We see if they need it. If they don't, we give them augmentation supplements that have been proven over thousands of years to help, which is very important to do. We don't just give everyone testosterone, men. So we have a lot of men who we then wean it down, which means we start at a dose, and then over time, if we fix the adrenal gland, which is a precursor to production of testosterone, they need less and less and less and less, and then we sometimes can just stop the therapy totally. So we've cured them of the testosterone deficiency. Same way, you can go online and you can get 16,000 products, but the dosages are wrong. They put 5 things together at 1/5 the level, so therefore you don't get the results. It's correct. Advertisement says the product does contain items that increase testosterone, but it's not enough. It's not adequate. Dosaging, again, is important. And when you take a supplement, it has to be quality. You get what you pay for in that arena. There's so much crap out there. I would say 90% of stuff on the internet is garbage when it has to do with hormone replacement therapy. Maybe even closer to 100%. Now, that is because there are companies that are established to basically rip you off. That's what they do. They use a little bit of knowledge, they suck you in, and you buy it for 2x, 3 times the price of what you can purchase a quality product that is physician regulated, quality in terms of knowing exactly what you're getting of the active ingredient, and then you can go ahead and monitor that and find the results what it's intended to be. We live in a wonderful time in the history of supplementation, because we have quality companies that have been doing this and researching it and studying this and utilizing age-old remedies that have been around for thousands of years and standardizing that to give you the dosage in such a format that you absorb it. To me, it's an incredible advance. So even though I call what I do traditional medicine, and I call what pharmaceutical-based medicine is pretty much a temporary sort of thing that was phased in 150 years ago and is really being phased out for chronic conditions. Now, for certain conditions, of course, medications are amazing. I think the future of this whole medical establishment is a merger of what I am doing with standardized medical pharmaceuticals, including the advances of surgical procedures. That's the future. Not giving you medication that can hurt you, that are poisons, that are not involved in the natural process of the body in every single way, which is why bioidentical hormone replacement therapy, when I was talking about it 30, 40 years ago, people thought I was crazy. And now everybody's copying it, but they're doing it in such a way that is just financially driven. Be very careful. Ask your doctor the questions that I'm bringing up here today. Why would you give me a pellet? What's the absorption? Do you have a study to show that the absorption is as you say? Question your doctor. You can question me. I give pre-consults. I meet every single new patient. I love it. And any questions you have, they ask me questions. A lot of them are very good, and I give them the answer because I know it. I've been doing this now for 30-something years, and I will tell you is that there is sometimes, rarely, a patient who comes to me with a question, and I don't know. And I say, wow, it's a great question, I'll get back to you. Rarely. But I would say, in general, I'd say 99% of the questions we get are good questions, we answer them, we have the knowledge, we have the experience. So beware out there. So I think that's basically it. So I guess in conclusion, let me say that remember that it's not just the product. It is the quality of the product. And another thing, I'll mention about the troche. I mean, that's the whole point, isn't it? So I almost forgot. See what I'm saying? I didn't sleep last night. See, I got foggy thinking. I forgot the main thing is what the advantages are of using the troche. So what's a troche? The troche's been around for hundreds of years. It was established in France in 1800s, 1700s, and it's basically a little gel that's melted, and into the melt you put in whatever it is you want to do. It solidifies, and you're able to put it into your mouth. I found when I started this that we're getting inadequate absorption of the troche, and if you put more than one hormone into the troche formulation, it falls apart. It can't contain. So through Bill Spears at Hazel Compounding Pharmacy and myself, we invented the troche in such a way where the quality of the troche sticks together and sticks together long enough to get adequate absorption transbuccally, which means through the mouth. Now, I learned as a young whippersnapper in medical school the history of utilizing Pitocin, which is a sex hormone, oxytocin, through the buccal mucosa. That's how it was administered before it was given intravenously. And I remember reading the fascinating studies that were done on how to determine dosaging of the transbuccal absorption. I put drops into the mouth to initiate and augment labor. So to me, that was well instilled in my brain, reading it and understanding the history of a product like Pitocin, oxytocin. And we applied that, transbuccal absorption, to our current modern therapy. So I bridged 200 years, but the history of medicine is such that if you study it, you can learn so much about what was done that was successful as an advance. Think about it in childbirth, how the augmentation of labor was done 200 years ago. Now, it wasn't totally safe because they didn't have fetal monitors. Technology wasn't there. They did not have the dosaging standardization that we have today. For example, Pitocin is given in units, which is exactly what they want to give, and you can augment the units by a certain rate per minute. So therefore, the quality of our administration is much improved. But to understand principles of medicine, which 95% of doctors do not, ask them the question. Talk about the history of Pitocin. Do they even know that Pitocin was given transbuccally? So, unfortunately today, we have a dumbing down of society. But unfortunately for all you listeners, we also have the dumbing down of doctors by the pharmaceutical industry to keep them dumb, to listen to what the pharmaceutical reps tell them. They come into the office, they sell them whatever they want to sell them, and the doctors don't know the first thing about it and just go along with it. They get a free lunch or they get a free trip, and everybody's happy. Beware, medicine has changed. It's not the doctor of 30, 50 years ago. And in this arena, what I have learned, the best message you can take away from this, and send this to all your friends and family, especially your parents, is do not listen to the doctor. Ask the questions, because most of it is propaganda. With that, I'm going to say goodbye, and we'll speak to you then.